Okay, perfect. Just then a small intro again to say welcome to everyone joining us. And thank you for making the time to actually be part of the Breakaway. We apologize for the time. We just had a few technical challenges that we had to actually start by addressing before we can actually go live. And again, with me, I have Katlego Nikamanzi, who will be co-presenting with me. And she will take us through the slides together with me. So Katlego, whenever you're ready, we can start.
Okay, thank you so much. Good afternoon, everyone. Thank you for coming through. And like Kuhle said, thank you for the patience. We have had some technical glitches, but we managed to oversee them. Thank you for staying tuned. Our program that we're going to present, it's Virtual Child and Youth Care Lifespace Work. Kuhle, if you may, please take me through the next slide. We are aware that in 2020, we were hit by the pandemic of COVID. It hit us really hard and we didn't expect it. South African national lockdown commenced in March 2020. It was in a state of emergency. But right now we're functioning at level 1. Back then we had levels. We didn't even know how to articulate them well. We moved from level 5 up until level 1 now. And there are effects that came with that lockdown. We had impact that we've seen in the children that we're servicing, in the families that we go to day. Those were somehow restricted. I'll take you through the impact of the lockdown on children and families, that from the way it ranged during that time. We had an increase in unemployment. There was lack of income, and more families were left in more poverty since there was no income coming through. We had an increased number of food support. There was an increase in that. Families couldn't survive. You know, when we're referring to families who could not survive, let's make for an example, a learner in a quintile 1 school, whereby every day when they come to school, they're able to access breakfast, they're able to access lunch, and then the families or the caregivers are able to oversee supper. They make means to make supper, but that somehow was restricted. We all know that during level 5, even the schools were not providing meals. That came on board. Changes came as time changes, then the levels changes. When we moved to level 4, there was less restrictions, and children from the school, they were able to access food even though the schools were closed. So those are the challenges that we were referring to. There's a little bit of background. I don't know if you can step in, because I'm struggling to hear myself when I speak.
All right, no problem.
There's a background noise.
All right, no problem. So as my colleague was saying that, you know, there were a lot of disruptions to learning in schools. And also, you know, like there was shift in the services of child and youth care workers, which meant like limited movement for child and youth care workers to provide routine services or routine face-to-face work that during this time. There was also an increase in tailored services to meet the specific needs of children during the lockdown, whether it be food parcels, because, you know, like Katlego was saying that, you know, some learners could only access food during school hours. So when they were not able to come to school, they couldn't access this the meals that they usually accessed. And then this also meant that there needed to be a shift in the way in which we were providing our services. So we started developing a program called Virtual Connection Program. And then it had a blended approach to it, where it was face-to-face work and also virtual connection. this allowed us to actually extend our reach to the young people that needed us the most. And then the program implementation during COVID-19. So during the initial lockdown levels, child and youth care workers formed part of the essential service workers, as mentioned in the previous presentation by in the previous presentation by the board. So by the South African government, they were able to provide essential services to learners, and child and youth care workers provided face-to-face support in child protection matters and other emergency responses services. So you know that, you know, when learners are at school, when they are not at school, they are more vulnerable because maybe parents are frustrated because they've lost work. They've actually started drinking alcohol, and they come in and abuse learners. So the child and youth care workers were available to respond to those cases. So the NACCW developed the Virtual Connection Initiative, in which child and youth care workers stayed connected to children through virtual means. In this way, we were able to actually connect with learners, find out how they were feeling, find out how the pandemic and the situation at home was affecting them. So with the decrease in lockdown levels, child and youth care workers continue to provide both emergency response services and prevention and early intervention services to children through a blended approach of face-to-face and virtual connection work. So then moving on. So some of the services that we managed to provide through virtual lifespace included COVID-19 information training, sharing, teaching, and good hygiene practices during that time. Even now, we still continue to actually provide that information around keeping safe and keeping to protocols. And then daily safety and child protection check-ins, where child and youth care workers conducted calls, sent messages just to check up on learners, because we understood that not all of them had smartphones. So some of them we had to do family calls, where we call the entire family, or do individual calls to learners and send messages just to check up on them and how they are doing. We also did study programs or educational support programs. We had career expos virtually. We continue to provide soft copies of previous question papers. We assisted learners with study timetables so that they keep to a routine and don't lose a routine, because we understood that when it was time to come back to school, had they lost that routine, then they wouldn't be able to easily adjust back into the school. And we had discussions on life skills and social issues, which included buddy beat groups, which consists of 5 or more children in one group facing a similar issue or challenge in terms of their development, and will actually group those learners together. And that actually supported in peer-to-peer support and the development of coping strategies amongst themselves. So as I've mentioned, that we've actually worked on career expos. So so the virtual career expos was a national career expo where we had learners from all around joining a WhatsApp group. And then we brought in stakeholders from different institutions. We had people from REAP, we had people coming in from financial aid, assisting with learners on how to apply, when to apply, the different careers that are out there. So young people had access to that. And then we facilitated reading activities through Funza and Nalibali reading sessions, where the Funza had a Mobi or a WhatsApp number where we can access soft copies of stories and then go through those stories with learners, and then have book reviews, because they also had books. So the Funza books are age appropriate. They allowed for continuous discussion. They allowed for engagement and fun and life skills learnings, a lot of life skills learning. So other activities that we ran were debates. We had spelling bees with poetry, we had creative writing, and online chess. So those are some of the activities that we provided virtually. So in this, we have been able to reach more than 2,000 children and youth that have been reached through the virtual connection program. Close to 20,000 phone calls have been made to children and youth. Over 200 virtual chat groups have been created with more than 1,500 children and youth. Close to 10,000 virtual chat groups have been done, reaching these children monthly. So when we talk about virtual groups, you'll find that we also run structured developmental programs within the virtual groups, where we run Vuchilo, we run, we run Vuchilo, we run ADP, and we run Lifebook. So those were the number of programs, or some of the programs that are structured that we ran virtually. And then virtual mentorship. So when we talk about virtual mentorship, how were the mentors providing support to child and youth care workers? So the mentors were providing support through distance mentorship, which meant like if the mentor is not there physically, the mentor can actually communicate via telephone, via email, or actually use platforms such as Zoom or a WhatsApp group call or Teams. And then where possible, mentors were able to provide direct mentorship and provide physical mentorship, where they can be able to model good child and youth care practice. So one of the case studies that came in one of our WhatsApp groups, that in KZN, a child and youth care worker received a message from a young person who was 17 of age, who no longer wanted to be part of the group. So the child and youth care worker was very worried about this sudden withdrawal on the phone. So Sihle disclosed that he had just ingested insect poison and wanted to commit suicide. Child and youth care worker immediately contacted Sihle's caregiver. Sihle was then taken to hospital, where he received immediate attention. The child and youth care worker stayed at the hospital just to observe and also support the Sihle by actually involving the hospital social worker for added intervention. Sihle and his caregiver were also referred to Lifeline for further assistance. So the attempted suicide was a result of a fight that he had with another family member, and he could not cope with the situation. Sihle's life was saved because the child and youth care worker noticed that there was a problem and followed up with him after identifying his statement as a call for help. The child and youth care worker is continuing to work closely with Sihle and his family on an ongoing basis. So this is just to just say the importance of actually having a child and youth care worker within reach, having a child and youth care worker that you can just simply, when you're not feeling okay, simply send a text and say, I'm not okay. And also the child and youth care worker also making those crucial observations, picking up on those social cues and understanding if a young person is saying this is not their normal baseline behavior, and then decide to actually pick this up and follow it up immediately. So Sihle's life was saved by the virtual program and the response from the child and youth care worker. So I mentioned earlier about the educational support using past year exam papers as reference in the WhatsApp groups. So in creating those, we had soft copies of exam papers, which we shared with learners and also engaged them to see whether they are completing the task and whether they are struggling, and brought in some teachers to actually come and assist as well, and created those groups and allowed for effective engagement within those WhatsApp groups. So resources needed for the successful implementation of the virtual lifespace work. So if we're talking about the resources, we know that there's some limitations to the implementation of this program, because understanding that not all learners have smartphones that they can connect on the WhatsApp groups. Not all have phones, and there are network issues at some point. So what is needed though for the successful implementation of the virtual program for both children and child and youth care workers is, so they need smartphones or any other phones that we can actually reach them through, because child and youth care workers also do phone calls. So one example that I'll make is that, sometimes because learners were attending on different days, learners would not easily adapt to that routine. So when it's time to wake up on the day that they are meant to go to school, they don't normally wake up and end up missing a day of school. So child and youth care workers always make sure that they follow up with a call, wake up the learner and make sure that the learner is up and ready for school. So those are, like, let's say you don't have a smartphone and I can't reach you, so the child and youth care worker will make that important call. So we look at data and airtime that they need to actually be able to connect, and also the training of our child and youth care worker, and also the capacity building amongst our child and youth care worker to be able to work virtually. And the last thing is around monitoring and evaluation, that to make sure that the services that you provide to learners is adequate and well monitored, and we can actually track the services that you are providing to the learners. Thank you so much for listening to this presentation and for the opportunity to present. I'll hand over to my colleague Katlego to add if I've missed some of the critical things in the presentation.
Well, thank you so much, Kuhle. You've covered everything so well. I'm sorry that I couldn't step in, that there's a lot of background noise where I am, but I'm not sure if there are any questions. Are there any questions that we can respond to?
Katlego and Kuhle, this virtual support has been carrying on for almost 2 years, and obviously you've had the experience of also supporting learners, matriculants in the time of COVID last year when they're and with your findings, what was the difference in their performance with the virtual support and with face-to-face support?
From my experience with the learners, it's just that they were so used to face-to-face contact. It was a bit of a struggle for them to adapt to that level of change because it was drastic. Hence, they had from time to time, even though the schools were closed, then they would make an exception for them to come to the school. But that adjustment, they needed constant support, more supervision, more encouragement from the child and youth care workers, because that's what they would do. You know, we developed these study groups, and from those study groups, we could monitor their attendance and their participation. Let's say, for instance, if a learner wasn't present for that study group, child and youth care workers would make a follow-up with them, maybe through a phone call or a text, and then they would get information as to why they're not participating. Some would share that their challenge is that they don't have airtime or data. Then we made provision for that. Others would be household chores, having to balance that from home. You know, when you're sitting at home and then you trying to study, sometimes it's viewed as being lazy. Those are the things that they shared as their anxiety, that they're struggling to juggle both personal and then having to be in a school setting, but doing it at home, it was a challenge for them. So we had to have discussions with caregivers just to make them aware that as much as learners are at home and maybe they're functioning at a level 5 of a lockdown, but there are some of the academic things that they need to attend to. Like there are study groups, make them aware that there are study groups, and within those study groups, they take place at a certain time. Maybe they take 2 hours in the morning and another 2 in the afternoon. And those are the times where learners can be given maybe a space where they can read and engage with their peers and also do their homework, because they take pictures of those homeworks and then post it in the group or send it privately to the teacher. So we had to help explain the process to the caregivers so that they too can also help support them. Then through that process, we saw more support coming from home, and then learners were given an opportunity to study and focus on their studies, you know, in terms of time management, how they manage their time, what to do in the morning and things like that. So for us, we saw that there was a shift. You know, there was a lot of anxiety about them passing at the end of the year. And somehow having those systems into place, whereby study groups were in place, there was airtime and data made available for them. caregivers were in support, so it improved their academic performance, Eddie. Hello?
Thank you very much, Katlego, for that. And it sounds all very interesting, because what you are saying, not only did you work with the learners, but you also built the capacity of the caregivers to understand the processes and also render support. Because again, I think that is part of what they need as they go through this process of matriculating, is the support of the parents or the adults in the house. And this is from my side. And I heard Kuhle talking about the virtual activities and debates and spelling bees and even chess. So how did you actually facilitate these online processes or group processes, like a debate, as you're talking about, and online chess? How did you facilitate that? How did that work?
Okay. So
Okay, I don't know if you mind stepping in,
yes,
please.
yes, I can. So for example, we'll start with chess. So for chess, what we did was that, you know, we gave them a link. So there's an app called chess.com where, so we created a WhatsApp group first, and then in that WhatsApp group were people that were interested in learning chess and willing to play chess. So we did initial, like, you know, the basics of chess, sharing with them, you know, the basics. And then after they downloaded the app, which is chess.com, which allows us to play together. So you create a profile. After you've created a profile, you get on the game, you download the app, you get on the game, and then you look for me. So I'll give you a name that, okay, I'm Kuhle, NACCW. And then you go look for me, and then we can play together. And then after the game, the chess, after the game, it actually, the app gives you stats of the game. So we screen grab those stats, come and share them in the group and say, this is how we play together. And this is where, you know, these are our stats. And then others can also do the same. And then they can share, maybe take screenshots as they are playing to share with us. And the app also allows us to watch a game. So as they are playing, we can actually watch a live game and maybe write in chat, because you can still chat with them on the app, sorry. And that actually allowed us to interact. And then with the debates, so with the debates, what we did is that we had a group, again, a WhatsApp group. We gave them different topics, put them in different groups. And then what we did, then they would choose a representative, and then the representative will come back, present the point. So what they'll do, let's say a group of 5. So in each group we have 5, and then they will actually have a video call together where they actually discuss what the topic was. And then one of them needs to come back to the group and write all the points that they had discussed, and then the other group will do the same.
Kuhle, thank you very much. And I've just got some feedback from the people that run in the background, and we've got 22 participants in this group, which from what we see is quite high. So I just want to say to each and every one out of you, thank you out there, thank you for attending. And I want to thank our presenters for what they are doing out there and taking the time to prepare the presentation for us. And maybe I mustn't be rude and share my video as well. It's not about me, it's our presenters. So I'll just do this for a second. So thank you very much. And again, just thinking about it and remembering that you've actually reached 2,000, I think was your number, 2,000 kids out there, and looking even at the story of the attempted suicide. And I think in this time, it's been so long and almost normalized, we forget about the struggle, the mental health of children and families and everybody's experiencing. And very important, even though it's in the virtual world, Kuhle, I can sense how there's still interaction in that quiet, concentrating game of chess, how you are actually still connecting there and then being with a child. So I can feel it, I can feel it. So thank you very much to the two of you. And thank you for everyone for attending. There's no other questions. So any final words from the two of you?
Thank you so much, Eddie, for that. I'll just a few words to say that, you know, working virtually or COVID-19, you know, it was a challenge. We first fumbled and didn't know how to actually remain connected, but we saw the need to actually remain connected to the children that we work with, and understanding that, you know, the risk factors that come with them having to now stay at school, having to now stay at home, sorry, having to now stay at home, and the kinds of risks that are out there and they are presented with on a daily. So we needed a way to actually connect with them. And, you know, this for us was, you know, something that allowed us to actually deliver the services that we know that they need, and also to actually make sure that, you know, there's a sense of routine and safety for our young people. So thank you so much.
Yeah, I echo the same sentiments, because working remotely, virtual connections, those are the words that we never thought they would be linked to childcare. But somehow we, as the childcare team, we were proactive in our response. We didn't know that this would come, but then the time it did, we were already set, you know. We had to find out how many learners had smartphones, how many learners had phones, that so that we can keep that connection going. And we were able to service those many that you mentioned, Kuhle. We tapped into another territory that we didn't think possible, but then we did it. Yeah, thank you so much.
Once again, thank you very much to Katlego and Kuhle. And your project can only go from strength to strength. And yeah, well done. And as a colleague, you guys will have our full support, and as part of the training team, we need to support you with the wonderful work that you do, and we're handing love. Thank you very much. Greatly appreciated, highly informative. Thank you very much for the presentation. Okay.
Thank you.
Bye-bye, and thank you to everybody else.
Bye.
And we will end the session now. Thank you.
Bye. Thank you.
Thank you. Bye-bye.